Therapy and treatment of psychological disorders. So now we're going to talk about some of the ways disorders are treated when they exist. First off, let's talk about who usually seeks treatment. Only about 15% of the United States population seeks treatment for a mental illness in a given year. The sort of common cold of all psychological disorders are anxiety and depression. So those are the most commonly presented problems. Women are more likely to seek treatment from a mental health professional than men. People who have insurance and are able to pay for the services are more likely to seek treatment, and people with higher levels of education. So here's a chart that kind of tells us some of the most common problems presented during a given year, and we can see depression and anxiety tend to lead the pack. This other chart shows us some of the demographics associated with people who seek treatment. If you look at age, people between the ages of 35 and 44, so think about what's going on in a person's life between the ages of 35 and 44 and 45 and 54, that might lead them to treatment above everybody else. And then the next highest presenting age range is 25 to 34. So that's worth thinking about. When it comes to race and ethnicity, whites are more likely than blacks or Hispanics to seek treatment. Think about why that could be. We already talked about females being more likely than males. There's probably a reason for that as well. One of the interesting conundrums is education level. People who've had 17 years of education or over. So that's usually people who are college educated. Why would college educated people be more likely to seek treatment than anybody else? And for marital status, people who are divorced or separated, or people who aren't married. All of these demographic groups make sense when you think about some of the reasons. For example, between the ages of 35 and 44 and 45 and 54, people might be going through a lot of life changes. They might be empty nesters for the first time, or their children are teenagers, and maybe they are getting a divorce or separated at that point in their life. If we think about Maslow, they're kind of in the esteem level, or maybe the love and belongingness level of life, and that may lead to some mental health concerns. When it comes to race or ethnicity, why are whites more likely to seek treatment? Is it because of cultural stigmas associated with mental health for blacks and Hispanics? Also Asians. Are females more likely to seek treatment because they are more willing to talk about the issues that exist? Males don't really want to talk about those things. Could education level be, I have more education, I know that this is a problem, I know I can get help, and this isn't an issue. I have more time on my hands, where if I don't have as much education, maybe I'm too busy. I don't have time for something like that. And obviously a lot of research has shown that people who are married tend to be more satisfied in life than people who are not. So obviously, if you're going through something like a divorce or a separation, that's going to be very devastating. Here are the types of treatments we can have. You can have psychotherapy, which is any type of insight therapy, where people go in and they talk to somebody else and try to figure out why they're behaving the way they are. You can also have behavioral therapies that seek to change a specific behavior, like I smoke and I no longer want to smoke, so I need to go and change this about myself. Or you can have biomedical therapies, which is medication treatment to help. And you can also have a combination of those things. The people who provide treatment are going to be clinical psychologists, counseling psychologists. Psychiatrists are going to provide the medication. Clinical social workers can provide counseling. Psychiatric nurses can help in the field, and counselors as well. When it comes to type of therapy usage amongst practitioners, Most practitioners are going to say that they are eclectic and that they can do whatever it is a client needs in order to help them be successful. The first type of treatment is psychodynamic therapy, which is what we currently call psychoanalysis. Remember, Sigmund Freud first created psychoanalysis way long ago when he said that all of our lives are based on unresolved unconscious conflicts. Freud used free association, dream analysis, and interpretation. He also said that there are two things that can come forth in a therapy session that can impact a person's ability to get well. Those things are resistance and transference. Resistance is a mental block where a person goes into treatment, and they go in for counseling, but they really resist the help. Like they do things that will prevent them from getting the help they need. Like maybe they won't really talk about their problems. Or maybe they'll wait until the very end of the session before they say anything that's important. They are resistant to getting better. Oftentimes, if people have court-ordered treatment or if a teenager is going to treatment because their parents are making them, then they might be resistant. Transference occurs when a client develops feelings or emotions onto the therapist, but they're not feelings or emotions toward the therapist, they're actually towards somebody else. Like, for example, if someone went to a therapist and that therapist reminded them of their mother, whatever feelings they have towards their mother, they would direct onto the therapist. So if they thought of their mother in a positive way, they would have positive feelings toward their therapist. If they thought of their therapist in a negative way, they would have negative feelings towards the therapist. So if that happens, it's important to address that within the therapy session. The second type of treatment a client can have is client-centered therapy. That was created by Carl Rogers, and he was a humanistic therapist who said that the important thing for a therapist to do is to be able to help restructure a person's self-concept and how they think of themselves so that they can better understand reality. Carl Rogers said that there are 3 conditions that are important for all therapists to have with their clients, and those things are unconditional positive regard. That means a therapist should accept anything the client says to them without judgment. The therapist should be genuine, meaning they should be honest and trustworthy and real. And they should have empathy, meaning they should be able to put themselves in their client's shoes and understand what they're going through from their perspective. The third type of therapy is a behavioral therapy. And behavioral therapies were originally created by B.F. Skinner and colleagues. The whole point of a behavioral therapy is to unlearn maladaptive behaviors and to learn new ones. So you want to get rid of behaviors that aren't positive for you, but learn behaviors that can be positive. Systematic desensitization is one type of behavioral therapy. It's a type of exposure therapy, first used to treat phobias, developed by Wolpe. And what happens with systematic desensitization is a client is taught not to fear something by first gradually exposing them to it. So it might start out with teaching ways to manage anxiety first. And let's just say you're afraid of clowns. So after you've learned to some coping skills for managing your anxiety, the next thing is you're shown a picture of a clown. And you get to practice how to manage your anxiety and how you feel after seeing a picture of a clown. To where the next thing after you're okay with the picture, you're able to watch a video with a clown in it and talk about your anxiety and deal with that, to where eventually you are able to see a clown in person, go through how you feel anxiety-wise, to where you're eventually able to take a picture with or stand next to or be with a clown if that's, maybe you're going to a party and clowns are going to be there, so you don't want to be scared. So that is gradual exposure therapy to help you decrease your phobia of something. Aversion therapy is another type of behavioral therapy which associates an unpleasant state with unwanted behavior. So if somebody has been an alcoholic or they've had some type of sexual deviance or smoking and they engage in aversion therapy, then perhaps they will, every time they take a smoke of a cigarette, they will get nauseous, so that eventually they no longer want to smoke because they don't want the nauseated feelings that come from that. Cognitive therapies are therapies that have to do with changing a person's irrational, illogical thinking. So there's rational emotive behavioral therapy, which was developed by Albert Ellis, and it looks at illogical and irrational attitudes a person has. Cognitive therapy, which was created by Aaron Beck. Its goal is to change negative self-talk and schemas, those negative ideas that you've created throughout your life. And cognitive behavioral therapies combine both cognitive strategies and behavioral strategies to try to change the way a person thinks in order to change the way they also behave. But the goal of all cognitive therapies is to change a person's thinking. And group therapy can involve one or more therapists working with several people at the same time. You can also have family therapy with groups. Group therapy has many benefits. It can be time and cost saving because you're treating so many people, so it can cost less. And you can see more people that way. It's a good way for people to develop social skills and good social behaviors if that's an issue or problem they're having. It's a way to provide feedback to clients who are trying to change their behavior. And sometimes if people feel like they're alone and nobody else understands what they're going through, it is a way to enable people to see others who share their problems and can relate to them. Biomedical therapies are any type of therapeutic drugs that can help a disorder. For an anxiety disorder, a person would take an anti-anxiety pill or an anti-anxiety drug such as Valium, Xanax, and Buspar. If a person is suffering from schizophrenia or any type of psychosis, they would take an antipsychotic drug. And some of those could cause a condition called tardive dyskinesia, which has to do with kind of involuntary body movements that result from taking Thorazine too long. Mellaril and Haldol are also antipsychotic drugs. If a person is suffering from depression, they could end up taking a tricyclic drug, an MAOI, or a SSRI. And they all have sort of different functions, but it's a psychiatrist's job to figure out which one will work best. If a person is suffering from bipolar disorder and needs a mood stabilizer, they could be provided with lithium, valproic acid. Electroconvulsive therapy is a controversial therapy that has been used but can cause seizures, memory loss. Was used a lot in the past as a shock treatment for severely depressed individuals. And in the past, lobotomies were used as a type of psychosurgery where a person's nerve fibers in their frontal lobes were cut to help calm them. That's not really done anymore. Those are really all of the types of ways we treat psychological disorders. But now let's talk about how we evaluate the effectiveness of those treatments. First off, if we just ask a person if therapy is working for them, we can't really take a person's view of whether it's working as valid, because whenever a person seeks treatment, they're often in crisis. And if their crisis passed, they're going to automatically feel like therapy helped them. Clients may need to also believe that therapy worked since they invested in it. They invested their time, they invested their money. So of course, if you invest something into something, you're going to say it worked for you. And most clients will usually speak kindly of their therapist, especially if they seek one that really relates to them. So they're going to want to say that that relationship is valid. Now, those things aren't to say that therapy isn't valid, because it is for a lot of people. We just can't always take people's word on it because they have a vested interest in getting better. In 1956, Einzig did a research study that still serves as a bunch of basis for insurance companies now when it comes to treating clients. In this study, 2/3 of people who received therapy improved. 2/3 of people who were on a waiting list or in the control group also improved, because we all know that time is a great healer. So if people just give themselves time, they will often improve naturally. Einzig's research study was considered limited because of the small sample size. It was only 24 studies that he looked at. And even though this research study tells us that people improve just as much in therapy as out of therapy, one good factor that the research study tells us is that people who use therapy are more likely to develop coping skills and strategies that will help them in the future. So they will improve a lot quicker and with less risk of relapse than individuals who never seek help. Because if you never seek help, you're probably going to continue going throughout the same cycles in your life and continuing to have the same problems. So what are the benefits of treatment? Psychotherapy is cost effective. When people seek treatment, their search for other medical therapies drops about 16%. We know that there are plenty of people who go to their primary care physician for issues that are psychological in nature. So those issues drop. And then it also reduces long-term costs. So when a person's psychological well-being improves, they are able to work better, they are able to have a better quality of life. There's no form of therapy that appears to be more superior than others. If you need behavioral therapy for a behavioral issue, you go and have behavioral therapy. If you're having any other type of issue, then you can seek any type of treatment. Psychodynamic therapy has been effective for depression and anxiety, and cognitive behavioral therapies have been as well. Having a therapeutic alliance is the key aspect of therapy. So that is a mutual bond of trust and understanding between a therapist and a client, so that you know when you seek treatment that your therapist is there to help you and you are there to work together. Resilience, or having and being resilient, is also important. It is the personal strength that comes with people coping with stress. So people who are resilient are more likely to be successful in therapy. And that's everything you need to know about the treatment of psychological disorders.